Hi friends, welcome to Nurse in Jellyfish. Today let's see the Jipmer question paper. First question. Nurse Linda was monitoring a 35-year-old male patient who was receiving blood transfusion. On assessment, the nurse found that respiratory rate is 24 and blood pressure is 90 by 30. So which of the following is the priority action by the nurse? So what is the action should be? Okay, the first option A, slow infusion rate. Option B, immediately flush IV line with normal saline. Option C, immediately stop the transfusion. Option D, notify the doctor it is. So what you have to do for the patient with blood transfusion? The blood transfusion is going on. So that time what is that? Respiratory rate 24, but the blood pressure is 90 by 30. Okay, so what you have to do for that? It is for this who are having receiving blood transfusion. Okay, so if it is altered, any vital signs is altered or any allergic reaction is coming, what you have to do that? It is, yeah, immediately you have to be stop the blood transfusion. So option C will be the correct answer. I think you got it the answer. Okay, fine. Next, move on to the another question. A full form of Niti Aayog is, what is that it is? Okay, option A, National Institution for Transforming India. Option B, National Institution for Transformation of Industries. And third, option 3, National Income Transformation Initiative. Option D, National Institution for Technical Initiative it is. Okay, fine. So what is the correct answer? In JIPMAT, they are asking this type of all, related to the community health nursing and also related to Indian welfare, health welfare agency, what other things are coming. So they are asking this type of questions only in JIPMAT. Okay, this is a JIPMAT question, so they have asked. Okay, so Nitya, what is that? What is the correct answer here? Yeah, National Institution for Transforming India. It is a correct answer for this question. That means option A will be the correct answer. Okay, fine. Next, move on to the third question. Okay, which of the following condition is an example of acute organic mental disorder? Can you understand the question? Yeah, acute organic mental disorder. So option A, schizophrenia. Option B, delirium. Option C, manic psychosis. Option D, obsessive compulsive disorder. Okay, in this questions, what are the things organic mental disorder? So we are having the two types of mental disorder. One is organic mental disorder, another is psychotic mental disorder. In schizophrenia, manic psychosis, OCD, these all the things comes under the which one it is? Psychotic disorder. Okay, the organic disorder is delirium. So option B will be the correct answer. Okay, fine. Okay, next move on to the another question. A nurse is analyzing the serum laboratory report for a client with lung cancer that has metastasized to the pelvic bone. Which of the following laboratory finding is expected? It is okay. So option A, elevated calcium. Option B, decreased hemoglobin. Option C, elevated creatinine. Option D, elevated creatinine kinase. So what is the questions here? Laboratory finding which is for that? Diagnosed with lung cancer that has metastasis to the pelvic bone. Actually the person is having what is that? It is cancer in the lungs it is. But it is metastasis to the pelvic bone it is. So what we have to do for the expected finding it is, what you have to check for it. If it is there in metastasis in this, so what you have to check the clinical finding it is. What is that it is? You have to check calcium or decreased hemoglobin, elevated creatinine or elevated creatinine kinase. What you have to check it is? Yeah, what is the correct answer here? Elevated calcium it is. Okay, fine. Next, move on to the fifth question. If the person is having C5, C6 anterior cervical discectomy, which priority nursing diagnosis should your nurse document in the plan of care for the patient? It is okay. Option A, potential impaired tissue perfusion. Option B, impaired skin integrity related to surgical incision. Option C, risk for infection. Option 4, that is potential ineffective breathing pattern. Actually, what is that? It is the person is having underwent cervical discectomy. Where is the cervical? C5 and C6. Where it is there? It is in the neck. It is cervical bone. Okay, spinal bone. It is cervical bone. That is C5 and C6. So, which is essential? Tissue perfusion, skin irritating infections, or ineffective breathing. So the surgery was done in the throat, near the throat section. It is. So which is essential now? Now you tell me the answer. Yeah, what is that? Option D, potential ineffective breathing pattern will be the correct answer. Option D will be the correct answer. Okay, move on to the another question. A nurse Linda is assessing a patient who visited OPD tentative diagnosis of hematological disorder. She noted that the patient has smooth reddened tongue and ulcer at the corner of the mouth. It is. Which of the following laboratory finding is most likely in the patient? It is. Option A, low hemoglobin. Option B, elevated RBC. Option C, prolonged prothrombin time. Option D, low white blood cell. It is. So what is the correct answer here? Actually, what is the question here? Nurse Linda received the patient with diagnosis of hematological but red tongue and ulcer of the mouth. So what is the diagnosis you should do for it? What is that? It was indicating what is the sign it is. Yeah, it is simply mostly it is happening pernicious anemia or vitamin B12 deficiency. So that means what is the correct answer here? Option A, low hemoglobin will be the correct answer. Okay, next we can move on to the another seventh question. And if you want any other persons like a BLS, CNE or maybe any other questions paper and AIMS questions, you can download my Nurse Genius app. It will be available and also all the questions, CNE, everything is there. You can try to learn it also. And you will have students period also, you are having all the syllabus, so you can watch it all. Okay, 60-year-old male patient who had a left total hip replacement and discharged with from the hospital 1 month before. He heard the nurse reporting acute constant pain in the left groin. Actually, what is that? He's having the pain and hip area, feeling like left leg is shorter than the right it is. A nurse advised the client to come to the hospital immediately, suspecting of which of the complications it is. Okay, option A, what is that? It is aseptic loosening of the processes. Option B, deep vein thrombosis. Option C, dislocation of prosthesis. Option D, wound infections. It is. See, actually, what is the question here? Total hip replacement. Okay, but when after that 1 week is giving this pain and the hip and also one leg is shorter than the other. It is. So what is happening here? Yeah, so one leg is shorter means what is that? It is related to it is a DVT or process. Yeah, process is only what type of process? Dislocation. That means the joint properly it is not placed. Something is happened that it is so dislocated. So that is why option C will be the correct answer. Okay, move on to the eighth question. Nurse Linda is caring for a child with hydronephrosis. Which assessment should a nurse perform to obtain the accurate determination of fluid balance in this child? Option A, measuring a child client intake output. Option B, weighing the client. Option C, assessing for edema. Option D, evaluated serum electrolyte level. It is. The person is having what is that? Fluid balance in the child. So what you have to do for that? It is but diagnosis hydronephrosis. What is the accurate maintenance of this question? It is what you have to do for it? It is yeah. What is that? You have to for the hydronephrosis pattern accumulation of fluid in the kidney. It is. So that means the kidney is going to be enlarged. So automatically weight is going to be increased in your body. So what you have to check it is weighing the client. It is. So what is the correct answer? Option B will be the correct answer. Okay, fine. Next, move on to the ninth question. AFB, what is that? Alpha fetoprotein is elevated which of the following conditions? Okay, option A, omphalocele, option B, gastrochiasis, option C, Down syndrome, option D, spina bifida occulta. So, what is the correct answer here? So, what is that? It is alpha fetoprotein. It is alpha fetoprotein. Which condition is going to come? It is, so usually it is one of the, what is that, elevated. Actually it is one of the congenital disorder that is coming different, okay, during the pregnancy. But here after the, what is that, the conditions of the newborn baby, which condition is going to come? That is gastrochiasis. It is option B will be the correct answer. See, all the question you have studied in the student period only, but who are all the students? It is now only you are starting for the exam, it is easy for you. But if you are getting more than 5 years experience, you forget all the theory knowledge. So that is why you have to read more questions, then only you come to know, again you will remember your knowledge. It is okay, fine. So you can prepare the exam nicely. It is okay. Question number 10. Abnormal copper accumulation seen in which of the following condition? It is option A, Wilson disease, option B, Parkinson's disease, option C, Sjogren's disease, and option D, hemochromatosis. It is usually in which conditions copper is going to be accumulated in the body? It is, what is the condition? It is, that is called it as Wilson disease. It is, you know, it is Wilson disease related to that. Okay. Next, we can move on to the another question. Which of the following location inappropriate to screen for jaundice in child? It is option A, skin over sacrum, option B, skin of abdomen, option C, ear pinna, option D, nail bud. It is usually when you are going to be assess the jaundice in child or any other person, what you have to check? You have to check the three things. It is, one is you have to check the eyes, you have to check the tongue, and third you have to check the nail bud. But here it is most probably it is presence there in the jaundice will be yellowish color will be present. So here what you have to correct answer? It is, can you check it there? Yeah, what is that? Nail bud will be the correct answer. Okay, fine. Next we can move on to the another question. Which of the following damage is most likely to occur during direct laryngoscopy? It is option A, gingival laceration, option B, damage to maxillary incisor, option C, damage to arytenoid cartilage, option D, damage to mandibular molar. It is. So what is the correct answer here? Usually during laryngoscopy. So laryngoscopy, when you are going to do that, which is going to be affected? Mostly it is commonest one, that will be the, which one it is? Arytenoid cartilage. So option T will be correct answer because that is going to be affected here. So always it is arytenoid cartilage is going to be affected. Okay, fine. Next, move on to the another question. A patient is suffering from hematemesis. Which of the following is the best diet option for this client? It is okay. So option A, solid diet, option B, liquid diet, option C, low fiber diet, option D, nil per oral. Actually, what is that? The person is having hematemesis. Hematemesis means, what is that? Blood in the emesis, vomiting in the blood. So okay, so blood vomiting, we can say that it is. For that person, shall I give any option for the diet? Nothing else. You should not give any diet for this. Usually when you are getting vomiting, you have to wait for nil per oral for some times. So then only it will be, if you are giving also again you will get a what is that, vomiting. But the person is having hematemesis, blood in vomiting blood. So you have to advise that, what is that? Nil per oral. So option D will be the correct answer. Next question. Which of the following antihypertensive drug is contraindicated in gestational hypertension? Option A, nifedipine, option enalapril, option C, labetalol, option D, methyl dophytus. So what is the correct answer here? Antihypertensive drug is contraindicated in GI hypertension. So which is contraindicated usually? Yeah, what is the correct answer? Yeah, option B, enalapril will be the correct answer. With the playlist also, you can read it to all the question answers. So every day we are giving new informations only. Okay, fine. Next, move on to the another question. Signs and symptom of fluoride deficiency include. So what is the question? Signs and symptom of fluoride deficiency include option A, weak bone, option B, yellow brown staining of the teeth, option C, dermatitis, option D, joint deafness. Usually what is going to happen if it is fluoride deficiency will be there? Yeah, what is that? Weak bone it is. So option A will be the correct answer. World Leprosy Day is 2020 is on option A 17 January, option B 26 January, option C 3rd March, option D 17th April it is. When is the World Leprosy Day it is? Okay, so what is the correct answer here? What is that? 26 February will be the correct answer. Okay, fine. Next, move on to the another question. National Road Safety Week was observed on option A 14th to 10th January 2020, option B 11th to 17th January 2020, options 3rd to 19th February 2020, option D 10th to 16th February 2020. So usually when is the National Road Safety Week it is? So usually when you are going to celebrate it, every year you are going to celebrate it. So it is on 11th to 17th 2020 it is. Okay, next move on to the another question. Complication of high flow oxygen in preterm neonate include acidosis. See, the question is preterm neonate it is. Okay, acidosis, and option B neonatal conjunctivitis, option C retinal detachment, option D retrolental fibroplasia it is. So what is the correct answer here? Can you guess it that? Yeah, so whenever you are getting high flow of oxygen to the baby neonate, which is going to be affected it is acidosis, it won't happen. Conjunctivitis, it is also. Only two things related to eyes. What is that? Retinal fibroplasia. The eyes are going to be affected with the high flow of oxygen it is. So that is why what is that? Retroplasafrontal fibroplasia will be the correct answer. Okay, next question. When the patient is undergoing surgery under general anesthesia, which of the following parameter is the first priority it is? Option A, reflex, option B, urine output, option C, ABG values, option D, vital signs including SpO2 with pulse oximeter. So what is the correct answer here? When the patient is undergoing surgery under general anesthesia, which of the following parameters? So general anesthesia, you think of it, that is general anesthesia. Okay, so for that cases, what you have to check it is, so which is very essential, yeah, vital signs with SpO2, that is a SpO2, oxygen is very important for that cases it is. Okay, so that is why option 19 for that it is option D will be the correct answer. Next question. Who discovered the value of biatus? Who discovered the value of biatus? Actually, it is related to a max it is. Anyway, they are asking because general knowledge questions also coming. So option A, Archimedes. Option B, Pythagoras. Option C, Hippocrates. Option D, Aristotle. Who has discovered the biatus? So who is that? Hippocrates, Aristotle, Archimedes? What is the correct answer? Yeah, option A will be the correct answer because Archimedes will be the correct answer for this question. Option 21, Which of the following medications is administered to a patient preoperatively to prevent infections? It is option A, antihypertensive, option B, antibiotic, option C, antitussive, option D, antihistamine. So for that conditions, patient is on preoperatively to prevent infection. It is everybody knows what is that. It is easy questions for you. Antibiotic. So for prevent infection, we are going to give antibiotic. That will be the correct answer for this question. It is okay. Fine. Okay. And antitussive, that is for cough. Antihistamine related to the allergy. Antihypertensive related to BP drugs. So antibiotic will be the correct answer. Okay. Next question. Which of the following chemotherapeutic agent is known as monoclonal antibody? That is question is monoclonal antibody. Option A, rifaximin. Option B, interferon. Option C, rituximab. Option D, indinavir. So what is the correct answer? Actually, it is one of the drugs related to the cancer drug, chemotherapeutic drugs it is. So what is the correct answer here? Yeah, rituximab, option C will be the correct answer for this question. That is a monoclonal antibody. So that is why option C will be the correct answer. Okay, next question. When is the Epilepsy Awareness Day is observed? So option A, March 7th. Option B, March 26th. Option C, April 7th. Option D, April 26th. So when is the Epilepsy Awareness Day? It is usually it was celebrated on March. Which one it is? 26th going to be celebrated Epilepsy Awareness Day. Every year is going to be celebrated. Okay, fine. Okay, move on to the another question. Okay, it is related to the PM question. You can understand. Pradhan Mantri Yojana. So what is that? Jantan Yojana was launched on which year? So option A, 26 January 2014, and option B, 28 August 2014, and option C, 26 Jan 2005, option D, 15th August 2005. So they are asking related to the current knowledge also. So you can read it out. So what is the correct answer here? 28 August 2014. What is that? Option B will be the correct answer for Pradhan Mantri Jan Dhan Yojana. So that will be the correct answer. Next question. Again, Nurse Linda is coming. Okay. Nurse Linda has received a post-operative total hip replacement claim from the recovery unit. Which of the following portion is appropriate for the client? It is option A, on the non-operative side supine portion. You just think it supine portion has legs abducted. A non-operative or supine portion with leg adducted. Side laying position with affected leg externally rotated. Option D, side laying position with affected leg internally rotated. So what is the correct answer here? So always whenever the hip replacement, non-operative side or supine position with legs abducted with the help of pillow you have to use. So option A will be the correct answer for this question. It takes. I think you have understand. Next, move on to the another question. Which of the following radioic substance is used in copper T device? It is option A, magnesium sulfate. Option B, barium sulfate. Option C, polyethylene glycol. Option D, iodine. It is. What is the correct answer here? Yeah, what is that? It is. So what is the radioic substance we are used in copper T? So what is the correct answer? Barium sulfate. In the copper T, what you are going to use? We are going to use a barium sulfate. It is. Okay, next question. What is that? 10% of 255 is, what is that? It is related to max. So option A, 0.255. Option B, what is that? 2.55. Option C, 25.5. Option D, 25. So what is the correct answer? They are asking 10% of 255. It is. What is that? So what is the correct answer here? Yeah, option C, 25.5 will be the correct answer. You got it now. You divided by 255 divided by 10, you can do it. 255 divided by 10 you can do, you will get answer. Next question. 200 percentage of your number of is 140, then water is 160 percentage of that number. What is that? So the question is option A 70, option B 112, option C 224, option D 242. So what is the correct answer here? They are saying that 140, then what is that? 160 of that number they are asking. What is the number? That is 112 will be the correct answer. Okay, got it now? Okay, next. Sorry for that. We are moved so far it is. Okay, next question. A 39-year-old male patient is admitted to the emergency department with dyspnea, tachypnea, pink frothy sputum. The nurse deformity that the patient is experiencing. What is that? Option A, neck trauma. Option B, lung abscess. Option D, pulmonary embolism. Car pulmonaitis. Actually, this question they are asking frequently for AIMS, even ESC question paper also. So, what is that? The patient with dyspnea, tachypnea, pink frothy sputumitis. Okay, always this question they are asking very frequently. So, what is the correct answer here? Yeah, what is that? Pulmonary embolism will be the correct answer for this question. Next question. All of the following side effects are expected in patient with oral cancer who is receiving radiation therapy except. I think you have understand all the questions. Okay, so try to read the questions and this video please like and subscribe my channel also. Option A, mucositis. Option B, serostomia. Option C, trismus. Option D, oral fluorosis. Okay, what is the correct answer for this question? Side effect of oral cancer. But what is that? You can understand in this two aspect. One is side effect of oral cancer, but who is receiving radiation therapy except they told. So except what is that? It is mucositis, serostomia, trismus, everything is coming, but only the oral fluorosis won't come. It is okay. So that is why option D will be the correct answer. I think you have understand all the question and answer. If you like this video, please like and subscribe my channel and also share to others. Thank you for watching Jellyfish Meena.